There you go.
Can you hear me now?
Yep.
Okay. Call to order the September meeting of the Sawyer County Health and Human Services Board. What's the first thing here?
Roll call.
Yeah.
Dale Schlueter,
Here.
Kay Wilson, Marshall Savitsky, Michael Maestri,
Here.
Chris Rusk, Lorraine Gouget, Dawn Pettit,
Here.
Carol Pearson, Sabrina Dunlap. You have a quorum.
Okay.
Hey, Lynn, it's Marshall Savitsky. I'm also on.
Great, thank you.
Here's my page. Okay. Roll call, Pledge of Allegiance. Stand, please.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Certification of compliance with open meeting laws.
This meeting has been noticed to the public as required by section 19.84 of the Wisconsin statutes.
Thank you. Meeting agenda. Everybody has a copy. Any changes? Okay, we have a motion.
I second.
Okay, everybody in favor, say aye.
Aye.
Motion passed. Agenda, public comment. Do we have anybody in the audience who wishes to make a public comment? Anybody online?
I see no hands up online.
Okay. Approval of the minutes from our August meeting.
I'll make that motion.
Thank you.
I'll second that.
Thank you. We have the motion and the second. Any discussion? Everybody in favor, say aye.
Aye.
Okay.
Aye.
Approved. Motion passed. Committee reports. Do we have anybody from LCO here?
We do not have a liaison designated yet, so still working on that.
And I just emailed Tweet again on that to see if
Okay.
he could get replacement.
Perfect.
Okay.
And you said we didn't have a senior center report, so we don't have a senior resource center report
No.
either tonight.
Okay. Administration.
Okay. Today we had our first all-staff meeting. Started out with giving an overview of Sawyer County related to county and HHS boards, just to get everybody on the same page. We talked a bit about how our administration works, population, economy, and finances, just to get everybody up to speed. We also reviewed our mission statement and let the team know that we are working as a leadership team on developing core values for the agency. And one of the core values that we know we want to go with is collaboration. And the whole intent of today's meeting was to develop interagency collaboration. So the rest of the meeting, every department participated in sharing all of their services. There was lots of good discussion, great engagement and questions, and initial feedback was that it was very positive. So we want to thank the board for supporting us in developing this. So thank you very much.
Yeah, you're very welcome. It sounds like a very
Ms.
positive
Dunlap
thing.
just joined the meeting virtually.
Beg pardon?
Ms. Dunlap just joined the meeting virtually.
Oh, thank you.
Okay. And that is really all I have for the admin update, but I do want to talk a little bit about Carol Lunt, if I can just jump right into the next.
Sure, please. Keep going.
Carol passed away just before our previous meeting in August, and we're always so used to having her on the screening, being a presence here with us. I just wanted to point out from Northland Counseling that we have Julie and Caitlin with us today to help support us and show that their continued support in moving forward with our programming with us. Carol was really devoted to the mental health needs of our northern counties, and Sawyer County contracted for services through Northland County for community support services. They provide staffing for transitions and for our mobile crisis. And we will greatly miss Carol, but I do appreciate the support that we're getting. I'd like to take a minute of silence in remembrance of Carol. Okay. Should I keep moving along on the agenda? Okay. So adult long-term care. Carol has added her report in here. I just wanted to point out a couple of things in her report. Hank Norris, he is our current disability benefit specialist. And I might have mentioned this last week, but he is going to be moving into the elder benefit position. So that's what Carol's position previously was. And we're in that process of getting him trained to transfer over. The disability benefit specialist is a regional position. It isn't something that we all work together on. And so at this time, we've put it out to other counties if they wanted to take it as well. Price County is interested in that and is looking at that. So we'll see how that position gets filled as we move forward. So they are looking at if they're able to do it, it'll probably be towards the middle of October. The other things with that report is that there's quite a few upcoming events that are happening. We included in here the caregiver conference that is going to be taking place. What we're doing this year is combining with other areas of the region, and kind of having watch parties in different locations across the county. And so the information is attached in here. It should be a great conference this year. So looking forward to that. And that is going to be on September 22nd. So if you know anybody who is a caregiver that's paid or unpaid, great conference for them to join. Mm. The other thing is that we are also working with supporting the tribal supporting outreach with Seven Winds Casino and the ADRC and the tribal caregivers. And so they'll be working there. And then on the 25th through the 29th, it's ADRC Specialist and Tribal ADRC Appreciation Week. So there's a kudos board across the state that we're able to link into, and Carol did include that link to be able to show the appreciation for the ADRC specialists. And then in addition, the Powerful Tools for Caregivers is also something that we're working with the region on, and great resource for those who are caregivers in our communities. So that covers that. Any questions on that report? Okay, moving on to behavioral health. There aren't any real new updates. I made note with Northland Counseling that we do plan on having services continuing as planned. Joe, Alicia, and I have also been meeting weekly to really look at some programming and looking at what other counties are doing in relation to all of the behavioral health services and looking at best practices. Joe, did you have anything else you wanted to add? I know Alicia's not on tonight. Okay, thank you. Okay, any questions for us on that? Hearing none, we'll move into Child Protective Services. You'll note in the Child Protective Services that we do have the Children in Care report. One of the things that we're going to be working on and have started to work on is really looking at the number of children in care and how long that they have been in care, and really trying to get some permanency in place that has not been worked on. And so Season is helping lead that. We'll try to create a report that will help show the difference in as we're starting to transition these kids into permanency. The other great thing I can report is our new staff have completed enough training that we no longer need the support of other counties and contracts to be able to provide additional services and to help us with on-call. So it is now fully in-house, and so we are very happy to report that.
Good.
Great.
Okay, any questions in that area? Okay, hearing none. Youth Justice, Sarah has provided her report there. Right now, Shannon Kraus, our new Youth Justice worker, is getting trained up. The other thing that Sarah and I are looking at is grant funding or opportunities for us to be able to develop a diversion program that would allow us to reach kids prior to coming into the justice system. So two of the places that we could start to reach out to them sooner is through truancy and THC. And if they've been caught with that, what does that look like? How do we go forward with that? And most counties don't really have a lot of programming towards that, but there are abilities to connect with people sooner, connect with these youth sooner, and hopefully prevent situations where they're dropping out of school and or starting drug use as a way of coping. So looking at what we can develop with that. So that's one of the things that we're working on from the youth justice side of things.
Good.
Okay, economic support. What?
What is THC?
Oh, marijuana.
Marijuana.
Sorry.
That's what they call it?
It's a chemical term. Yeah.
Oh, okay.
Sorry. It's when we usually do injustice, we're using that term. So, okay. And always stop me if I'm saying something you don't know. Looking at economic support, I know there's been quite a bit of overtime and things happening in that area. Do you have anything else that you wanted me to point out in that report?
Not in the report. Well, yeah, we just started.
You're going to need to, because they're not going to be able to hear you online. Sorry.
So just wanted to report that we started taking appointments for energy assistance. That program opens up October 1st and our lines have been busy. Appointments start next week. I have 2 workers that administer that program with me. So, so far, so good. We even had a furnace call this week. So a little surprised with that, but we're geared up and ready to go.
When you say furnace call, you mean somebody's furnace went out? Or?
Correct. They needed a furnace repair. So either a furnace repair or replacement. The program does provide assistance with both.
Good.
So
Thank you.
you're welcome.
Thanks, Shauna. Okay, and we have Julie here, so I'll turn it over to her for public health.
Thank you.
Julie McCullum, Public Health. Just want to highlight a couple of things with our fentanyl awareness team. We've had over 800 individuals contacted through outreach and educational efforts to date. Clean Sweep is tomorrow, which is a household hazardous waste collection that we're doing at the Sawyer County Fairgrounds. UW Extension is leading it, but there's public health support, and we actually have MRC members also volunteering at the event. Medical Reserve Corps volunteers volunteering at the event. Recently, well, in the month of August, our public health staff went through dementia training, so now we're considered dementia friendly as a public health unit. we participated in the winter school active shooter exercise. We hired a new public health nurse, Mary Sliz Chukka. So those are the highlights.
How did the shooting,
Back to shoot.
It was an active shooter drill with winter school staff.
how did it go?
It went well. It went well. There were two different scenarios that they went through, one during the school day scenario, and then an after school activities scenario. Darren Jensen from Sawyer Sheriff led that and did a great job leading that exercise. Public health was a part of it, both in an observation role and also thinking through the reception center, should there need to be reunification.
I hope we never need it, but that's good knowledge to him.
Julie, how about the fentanyl awareness? How is that received by the students as well as the staff?
So the students, that is upcoming,
Okay.
that hasn't occurred yet, but is on the schedule or getting scheduled. They were able to go to the 3 schools in Sawyer County to talk to staff, and overall that was well received.
Have all the signs and billboards been put out?
Many.
I've seen
And
a few of the little ones, but I haven't seen the billboard.
They're in, I think one is up for sure. There was kind of a progression of when those billboards became available. When those contracts were up, then we get to go into that contract time. So we'll have to validate, because I think that's through October. They should all be up. So yeah, lots of work. Lots of the work that was approved is getting ordered and moving forward.
thank you.
Thank you, Julie.
Okay. Yep, now we're into fiscal, and I believe we have Patty on the line. And I will just let her kind of speak to anything that she might think is important to note for us, or if you have any questions for her.
I am online. There is nothing unusual or to report. When you're looking at the purchase service recap, I want you to note that the Winnebago Mendota costs are only 4 months worth. That's all that through July. That's all we've gotten in is 4 months worth. We did present not only our budget, but then we did have indirect cost allocation for the county was received. So I did update our budget, which made the county money request go down a bit, and turn that into Andy and Mike Margren for their perusal.
Thank you, Patty. Just as an aside, does anybody know if Andy is going to have that on the agenda for the upcoming conference this next weekend for the whole county, the county association to talk about that? Go away.
I thought that was going to be a general topic, but I cannot be sure.
Okay, I was just curious. Thank you. No,
Oh, the shared revenue
The-
piece,
Correct.
the new shared revenue and how that looks and what we can spend on.
well, we're not going to get that much.
Oh, now you just bumped it off. There you go. Now you're on.
Okay, Sawyer County doesn't stand to get a lot of money in the shared revenue because we have, believe it or not, a high income county. Some are and some aren't, but
Mhm.
we've been cautioned not to expect. We'll get some, but not to expect a lot. No, I was thinking about the long-term care and the people in Mendota and the other
The
one.
cost sharing.
Yeah, the cost sharing with that. Trying to
Trying to
get the
get the
state.
Pick up more.
Pick up more with that. Okay.
Okay. So,
Okay.
thank
Make
you.
note. I'll make note and find out.
Okay. I think we're
Okay.
done. Budget performance sorts, future agenda items. Anybody got anything they want specifically? Okay. No correspondence reports. Maybe next month we'll have a report from WCA conference. We're adjourned.
Okay, thank you.
Wow, that's a short meeting.
Thank you.
Thank you, Dawn.
Thanks.
Good night.
Good night.